Good afternoon, and welcome to today's lightning webinar, Liver Cancer in Indian Country. My name is Ashley Struess, and I work with the American Indian Cancer Foundation. Today's lightning webinar, which will be 15 minutes long, is intended to provide a brief overview of the liver cancer, risk factors, signs and symptoms, and prevention. Wow, that's a lot. So let's hope we can get through it all today. Due to the limited time of the webinar, we will not be answering any questions, but you will be given the opportunity to ask questions in the evaluation form or in the chat box. The evaluation form will be sent to you as soon as this webinar is complete. You should be able to find it in your email that you used to register for this webinar. For those of you who registered and are currently attending this webinar, your name will be entered into a prize drawing. But wait, there's more. If you also complete the evaluation form, your name will be entered in a second time. I would like to thank the Clinic and Community Health team and the Urban Cancer Solutions team for help creating the contents that we will be given out today. Now, without further ado, on to the main attraction. For those who like pictures, here's one for you. The dark mass in the picture is your liver. The liver is the largest internal organ in your body. It lies right underneath your right rib cage and under the right lung. The liver is made up of cells called hepatocytes. The liver has bile ducts that extend out of the liver, carrying bile to the gallbladder or to the intestines. The liver has several important functions to keep a body healthy. The liver breaks down and stores many of the nutrients we receive from the foods that we eat. It secretes bile into the intestines in order to help absorb those nutrients that we eat. The liver makes clotting factors that prevent excessive bleeding in the case of a cut or an injury. The liver also breaks down alcohol, drugs, and toxic waste in the blood, which can then pass through the body safely as urine and stool. Liver cancer. Liver cancer starts when cells in the liver begin to grow out of control. The different types of cells found in the liver can form several types of malignant cancerous or benign non-cancerous tumors. For those who like graphs, here's one for you. This graph, as you can see, is divided in half between men and women. The dark red represents American Indian and Alaska Native community members, while the gray represents non-Hispanic whites. It is also broken down by liver cancer diagnosis and liver cancer death. As you can see, for every 100,000 American Indian and Alaska Native men, 16.1 are diagnosed with liver cancer, while the diagnosis rate for whites is 7.3. Now for women. For every 100,000 American Indian and Alaska Native women, 7.7 are diagnosed with liver cancer, while the diagnosis rate for whites is 2.6. These slides will be made available to you after the webinar with additional notes and statistics for people who like that. That covers the very basics of the liver and liver cancer. So let's move on to talk about the risk factors, prevention, and signs and symptoms of liver cancer. This is a list of factors that can increase your chance for developing liver cancer. Gender. Liver cancer is more common in men than in women. That would explain why our earlier graphs had higher numbers for men rather than women. Race and ethnicity. American Indians and Alaska Natives have higher rates of liver cancer diagnosis and death compared to whites, again shown in our graph earlier. Hepatitis B or C. Infections are the most common risk for liver cancer worldwide. And I'm going to talk a little bit more about what hepatitis B and C is in the next slide. Cirrhosis is a disease where the cells of the liver are damaged and are replaced by scar tissue. There are several possible causes of cirrhosis. In the United States, the most common causes are alcohol and chronic hepatitis B or hepatitis C infections. Alcohol abuse is another risk factor as it is the leading cause of cirrhosis in the liver. Obesity is also a risk factor as it increases the risk of other fatty liver diseases and cirrhosis. Type 2 diabetes is thought to be a risk factor as people with type 2 diabetes are more likely to be overweight. Anabolic steroids are male hormones used by some athletes to increase strength and muscle. Long-term exposure to these steroids can increase the risk of liver cancer. Aflatoxins are substances made by fungi. They are common in warm tropical countries, not like Minnesota right now, and long-term exposure to aflatoxins can increase the risk for liver cancer. Arsenic that is naturally occurring, such as that found in well water, can increase the risk of liver cancer. And commercial tobacco use is also a risk factor. Current smokers have a higher risk than former smokers, although both groups have a higher risk than non-smokers. Now, as promised, a little bit more on hepatitis B and hepatitis C. Hepatitis B is a serious infection in the liver. For some people, hepatitis B can become chronic, meaning it lasts more than 6 months. Having chronic hepatitis B can increase your risk for liver failure, liver cancer, or cirrhosis. Many adults with hepatitis B recover fully, even if their signs and symptoms are severe. A vaccine can prevent hepatitis B, but there's no cure once you have hepatitis B. Hepatitis C is also a serious infection in the liver that can cause inflammation of the liver. About half of people with hepatitis C don't know they're infected, mainly because they have no signs or symptoms until serious damages to the liver occur. For that reason, it is recommended that people with an increased risk get a one-time screening blood test. There is no vaccine to prevent hepatitis C, but treatment options are becoming more and more accessible. Now, I hope I didn't scare you off too much with the risk factors, but we're going to change the pace and move more on to prevention of liver cancer. So you can prevent hepatitis B by getting vaccinated. All children and adults who are at risk can be vaccinated. You can also prevent hepatitis B by not sharing used needles and practicing safer sex, such as consistently using a condom. You can also get screened, remembering that there is no prevention for hepatitis C, but you can get screened through a one-time blood test. You should get screened if any one of the following applies to you. Anyone who has ever used drugs, babies born to mothers with hepatitis C, anyone who has been exposed to another's blood or accidental needle sticks, anyone treated with clotting factors before 1987, anyone who received a blood transfusion or organ transplant before 1992, sexual partners of anyone diagnosed with hepatitis C, people with HIV, anyone born between 1945 and 1965, and anyone who has been in prison. That is a lot, and I apologize. Now, if it's too late to prevent hepatitis infection, it is important to treat hepatitis C infection. And like I said earlier, the treatments are becoming more and more accessible. Limiting alcohol use or drinking in moderation is also a prevention tip for liver cancer. Drinking alcohol can lead to cirrhosis, which is a risk factor for liver cancer. Avoiding commercial tobacco use lowers the risk of liver cancer, as well as a number of other cancers that are life-threatening. Maintaining a healthy weight helps prevent obesity, which reduces, again, your risk for liver cancer and other cancers. Limit exposure to cancer-causing chemicals, such as those mentioned previously, the aflatoxins and arsenic. Treat diseases that increase liver cancer risk. There are certain inherited diseases that can increase the risk of liver cancer, and finding and treating those diseases early in life can decrease the risk of liver cancer. Now, on to signs and symptoms. The most common signs and symptoms are unintentional weight loss, loss of appetite, feeling very full after a small meal, nausea and vomiting, enlarged liver felt as a mass under the right ribs, enlarged spleen, abdominal pain near your right shoulder blade, swelling or fluid buildup in the abdomen, itching, and yellowing of the skin or eyes. Other symptoms can include a fever, enlarged veins on the stomach that can be seen through your skin, abnormal bruising and bleeding, and individuals with chronic hepatitis or cirrhosis may feel worse than usual or have changes in lab test results. Symptoms of liver cancer usually don't show up until later stages of the disease. However, sometimes they are noticeable in the earlier stages. Small liver tumors are hard to detect under a physical exam because most of the liver is covered by your ribcage. By the time the tumor is felt, it might be very large, which is why it's very important to go to your doctor. Going to your doctor when you first notice symptoms may lead to earlier diagnosis when treatment is more likely to be successful. Many signs and symptoms of liver cancer can be caused by other conditions, including other liver problems. Still, It's important to see a doctor right away if you have any of these problems so that the cause can be found and treated if necessary. Now, for those of you who are familiar with our AICAF resources, you may be surprised that we don't have anything developed for liver cancer. But don't you worry, we are currently in the process of identifying what that resource should look like and what information it should convey to providers and community members. But we need your help, whether you are a provider talking with a patient about liver cancer or a community member looking for support. We want to know, what would that resource look like to you? What information would it contain? And how would it be used? On the evaluation form, we ask just that question. So please fill out the evaluation form and give us your honest feedback. Remember, to those who are registered and attended today's webinar, your name will be entered into the prize drawing. And if you complete the evaluation form, your name will be entered a second time. Again, the evaluation form will be sent to you shortly after the ending of this webinar. Attendees will be given 24 hours to complete the webinar. Hopefully by 2:00 p.m. tomorrow, a winner will be announced via Facebook and email. Thank you all so much for joining me today, and I look forward to receiving your feedback.